I'm Hannah Austin. I work on 3 North here at Methodist Hospital. It's a cardiovascular and peripheral vascular medical surgical unit. My unit, we have a lot of nurses of varying experience and background, so I asked all of them for some of their tips and tricks and hacks that they have that they use every shift, and these are some of the ideas they shared. So sometimes you can get a lot of pumps with multiple sets of tubing and everything can get tangled and confusing when it's all thrown over the hooks up top. A lot of people don't know that all sets of tubing actually have a little spot where you can clip the end on the other side of the roller clamp. You just snap it in and it keeps your end from hitting the ground and keeps everything from getting tangled. So a lot of times you have some medications that you might pull out of the Pyxis that the label might be damaged, or you might accidentally throw it away after you give the medication. But you can reprint any medication label off of the Pyxis. All you have to do is select your patient that you need the label from, and you would click Past Remove. And then it's going to pull up all the meds that have been pulled on that patient and say that I accidentally threw away my Norco label before I scanned it. You just hit the med that you need and click Print Label, and it will print it on the insulin label with a little barcode that you can scan again. And then you can just scan the barcode and you don't have to worry about getting a new label. I've got an IV placed into a fake arm here to show that drawing blood back with a 3 ml syringe can be a lot more effective than using a 10 ml syringe when you're drawing back from an IV. Now normally you would flush and waste a little bit and you would clean your lumen before attaching your syringe. But using a 3 ml syringe doesn't put as much pressure when you're trying to draw back. So if you use a 5 or 10 ml syringe when you're drawing back for blood, it can collapse the vein or it can pull the valve back, which will keep the blood from coming back into the syringe. If you use a 3 ml syringe, it can make it a lot easier to be able to draw out of IVs to get the blood that you need for labs. Not only do all these hacks help save the nurses time, but they also help benefit our patients. That way we can provide the best care possible.